Assalamu alaikum everyone. Welcome to Medical Education Nepal. In previous video we have discussed the OSPI and the weapon board section, and in today's video we will discuss about the poison board. Okay, so as soon as you enter your poison board, the teacher will ask you like what is in front of you. Okay, there is a tray of weapon. So instead of telling sir this is a tray of weapon, you will say sir this is organic and inorganic substances with vegetables. So this might be a new thing for you, but this is what usually the teacher wants to hear. This is organic and inorganic substances with vegetables. Okay, so now the teacher might either tell you to pick up one of your favorite poison that you have came by preparing very well, or the teacher will just randomly select one of the poison for you. Okay, you might say, okay, you pick up the OPC, you pick up the alcohol or anything. Or the teacher might go like, okay, tell me among these or lots of poison, which one of is actually not a poison. Okay, so there is only one answer, that is alcohol. Okay, and the teacher might also go through like, okay, tell me among these all poison, pick up the poison which is like absorbed through all the roots, and there is OPC. Okay, so this is also one of the questions that was asked with me during the Viva. So organophosphorus compound. So it depends, there is also the box questions. The teacher, if you are not going well, the teacher might go into the box question, but if you just continue, the teacher will continue with along with the questionings, you know. So usually I have seen in my medical college lots of the external, they used to ask like OPC. OPC is like there is very favorite type of poison. Okay, this is also absorbed to all the roots. So if defining OPC or what is the source of OPC, there is only one answer, that is the esters of phosphoric acid. And then classify OPC, aryl phosphate, alkyl phosphate, you've already done it. And talking about like description of the poisons, if suppose if teacher tell you, okay, you pick up the OPC, then you will just pick up the OPC and just you have to like describe it. Okay, this is clear, this is amber color bottle containing oily liquid having kerosene like smell, known as organophosphorus compound. Okay, so after that the teacher might ask you why it is color, why it is in the amber color bottle, why not in a normal bottle. So it is for the prevention, to prevent the oxidation, from the sunlight. So for that reason it is kept in an amber color bottle. So I have discussed everything and of every poison, how you will describe it, how you will hold it, in my item video. You can see, go through there. Okay, the Viva questions, the written questions are also discussed over there. So there is nothing new coming from them. So suppose if the teacher will ask you like, okay, OPC. From OPC only you have like signs and symptoms, muscarinic, nicotinic, CNS symptoms. One thing is there, in you see in OPC every secretion is increasing, all the secretions are increasing. But if you talk like just opposite of OPC, there is one poison that just act opposite of OPC, there is Datura. Okay, Datura, what happens, all the secretions get decreased. There is, you have learned that there is 12D, or there is a Morton science. You see there is dryness of the mouth, then there is dilation of the pupil. So every secretion you will there is decreasing, and in OPC every secretion is increasing. This is like two correlating things the teacher might come up with. Okay. So usually the OPC, if teacher asks you like who gets the OPC, the mostly the farmers. Okay, from them they will go into the prophylaxis, like the precautions, what precautions can be taken, what is like the antidote, what antidote can be given, atropine sulfate. Then there is a specific atropine sulfate, dose, how much is given in the initial phase, in the later phase. Then there is also the pralicdoxin chloride, and currently now it is with oxydoxin chloride. You have already discussed this all in the item video. So apart from OPC there is alcohol. So from alcohol, teacher asked me like how can you like percentage of alcohol, different drinks asked, then there is a percent. How will you describe the percentage of alcohol? You can describe in gram per week and as well as milliliter per day. Okay. Then there is also like alcohol by volume, and then there is a proof alcohol. So my question was, what is meant by proof alcohol? Okay. Then there is underproof, overproof. These are the questions that were asked. Then there's what is meant by absolute alcohol, 99.90% of alcohol. Okay. From alcohol, these questions were asked, and then there is like if talking about datura, from datura, this is the plastics that are containing dried leaves of datura with seeds, and from them usually the modern sayings is asked, you know, DRBHM, dry as a bone, red as a beet, all those things. And then another important question is like stupefying dose, and then there is fatal dose for datura. You know, stupefying dose is like 50 to 60 crush seeds, and then there is the fatal dose is like 100 to 120 crush seeds, or 0.6 to 1 gram. Okay, so this is also important. You have to know this. And how many seeds are usually present in datura? There is like 400 to 500 seeds. Okay. Then there is cannabis indica. Cannabis indica usually I won't seen, but it can also be asked. Arsenic. Okay, arsenic. One of the thing is during the sources of arsenic, I have told like it is found in the underground water. Okay, so the teacher might ask you, is arsenic found in the surface water? So then no, arsenic is not found in the surface water. Surface water like river, lakes, you know. So these are the things. And there is also one other common question is like, what is the treatment of chronic arsenic poisoning? So you know, the arsenic, it is medically, it is two types of poison. One is accidental and one is homicidal. Homicidal, when it is when causes acute poisoning, is homicidal, and when there is chronic poisoning, it's called accidental. So how will you deal with the chronic arsenic poisoning? So you know, we know that the chronic poisoning, it is caused by drinking the contaminated water with arsenic, and the place where I'm studying, Faridpur, it is a zone of arsenic. So arsenic is present in the drinking water. So first of all, what you can do, you can just stop drinking the contaminated water. Okay, and after that, what you will do, you will drink the plenty of fresh waters. Then you will take some fresh vegetables. So these are the things that you can do for treatment of the chronic arsenic poisoning. And in arsenic, there is chronic arsenic, acute arsenic poisoning. Yes, there is also in the postmortem finding, you like there is subendocardial hemorrhage. This is the thing that the teacher wants to hear. Okay, this is from the arsenic. Then leads, the various compound of leads is usually asked. What are the different names? What is it used for? Okay, and then there is side effects of lead. You know, plumbism we have studied. Okay, chronic poisoning by lead, the plumbism. In the plumbism, they have studied what there's a lead line, you know, Bartonian's line. It is also important. This is usually asked. And then there is also in the reproductive system, the side effect, it is usually sterility. So that is the reason why the teacher used to say, if you are living in Dhaka city, then you just get married earlier. You know why? Because in Dhaka there is around 25% of the air is polluted with lead. So there is presence of lead. So in the long term, it is definitely going to affect the reproductive system, and the most important thing is it develops sterility in both male and female. After that, there is like a menstrual disturbance in case of female, there is loss of libido in case of male, but the main thing is sterility. So that's the reason why teacher used to say like get married earlier and all that. Okay. All right, so talking about other section, like in the poison board, there is not only the poison, there is also like pregnancy, infanticide and all things. So the very first question was actually not from poison, it was from pregnancy. So what hormones you will get in the immunological, is present during the pregnancy, immunological test. So there is SCG and SCS, human chorionic gonadotropin and human chorionic somatotropin. These are, and if these are found in maternal blood or not. So yes, these are found in the maternal blood. This was my first question actually during the Viva. Okay, from sexual offenses, it depends upon the teacher, what questions they might ask you. And usually like the cases signs of active and passive agents in sodomy, these kind of things are usually not asked, but I have seen this type of questions. Most of the teachers, less of the teachers, fewer teachers, exceptional teachers are usually asking, to give you the better marks. So these are the things, these are also the things that you need to consider while studying for poison board. Apart from that, forensic psychiatry, how will you manage an insane person? This, and yes, the important thing is poisoning case. Suppose a poison case come to you, how will you manage the situation? There is medical management and then there is a legal management. I have described each of them in a very detailed way. There is assessment of the patient, then there is ABCD management, removal from the source, removal of unabsorbed poison, symptomatic treatment, use of antidote, lots of things. And legal management, first you have to know the particulars of the patient, particulars of the person who brought the patient, dying declaration, police to be informed, and lots of things as well. You just go through the item videos, you will get each and everything, you will understand each and everything. Whatever is given in this Viva video, there is nothing exceptional. Only these things like what is the tray of weapon is called, and all those things extra. Alright, so let's solve some, look at some box question. If we look at some box question like define rape. Okay, there is an exceptional question, what is the ectopic sites of pregnancy? This is usually what we haven't studied, but it's in the box question. So it can be like abdominal cavity, fallopian tube or uterine tube. Then there is external internal os of the uterus. These are the things. What do you mean by hymen? This is simple. What do you mean by marriage, divorce? Then there is what you mean statutory rape. Rape means statutory rape means like it's like having sexual intercourse with a person, with a woman who is like less than 16 years of age, even with her consent. Less than 18 years of age, even with her consent. This is known as statutory rape. Okay. Define sodomy, impotence, sterility, everything I have touched. What do you mean by lochia? What is lochia? Lochia is actually, apart from definition, it is a sure sign of delivery. Okay. Then there is cause of rupture of hymen. Why alkali is more injurious than acid? Two reasons: deeper tissue penetration and liquefactive necrosis. Okay. Signs and symptoms of acute arsenic poisoning. This can be done. Define poison. Then complication of vitriolase, permanent blindness. Mechanism of action of OPC. Yes, this is also one of the most important questions. What is the mechanism of action of OPC? After the ingestion, gets absorbed. It's inhibit the acetylcholinesterase, then inhibits the production of acetylcholine. Then there is a decrease in the breakdown of acetylcholine into acetic acid and choline. Then there is increase in concentration of acetic acid, and then ultimately decrease the transmission of impulses to the nervous system. So this is also important. This is also important for your OSP question. What is OPC chemically? Chemically, it is esters of phosphoric acid. Okay. What do you mean nullity of marriage? Marriage never to have been existed in law. Okay, I have written some answers to one question, but there is no question given. What are the other poisonous insects? Okay, apart from snake, there is scorpion, there is bee, there is centipede, ant, lizard. These are the things. Classified drink, you can either go for the soft drink, moderate drink, or hard drink, or you can go just like a vodka, rum, whiskey. Then there is a port series, then there is a beer, wine, champagne. In this way also you can describe. Okay. Circumstances where marriage. This is a board one. not required over here. Battered baby syndrome, child who have received repeated physical injuries, defined infanticide can be done. How OPC can cause respiratory depression. Okay, OPC can cause respiratory depression. There is asphyxia. Okay, usually OPC usually affects your diaphragm. Diaphragm, it is a chief muscles of respiration. So it like paralyze the diaphragm, and then that will lead to asphyxia, and then you cannot breathe, and it causes the respiratory depression. What do you mean by carbonuria? When urine is fresh, it is whitish or slightly greenish color, but after exposed to air, because of the oxidation of hydroquinone and pyrocatechol, it changes in color into greenish or black. This is known as carbonuria. Tell me the source and medical legal importance of kerosene oil. Source of kerosene oil is fractional distillation. Fractional distillation, by fractional distillation and purification of petroleum products, I guess so. Okay, and then there is medical legal importance. Medical legally, it is an accidental poison in case of crawling babies 6 months to 2 years of age. You know that. Muscarinic and nicotinic effects of OPC. Muscarinic, BP slush, given the mnemonics, I hope you remember, and nicotinic, CMHPTEYE, I guess so. Okay, this is a mnemonic. How can you treat a case of chronic arsenic poison? Already told. How can you take? First, stop drinking the contaminated water, then take less amount of fresh water. Then there is indication, contraindication of stomach was. Okay. Okay, I guess so. This is all. Okay, what are the signs of late pregnancy? Late pregnancy, positive signs will obviously occur. So these are the positive signs. What specimen you will be collected in a rape case? What is specimen you will collect? There is blood, urine, then there is a saliva, then there is a hair from the scalp, from different part of the scalp, from the body, then genital swabs, blood, urine for alcohol, drug, venereal disease screening and all. What do you mean by virginity? What do you mean by defloration? Already told. What is indecent assault? Sexual misbehavior of a male usually committed on a female. Examples of indecent assault: touching a woman in public place. Cause of rupture of hymen, accident, sexual intercourse. Okay, first of all you say sexual intercourse, then you say accident and all that. Okay. Prerequisites for rape case, already told, 5 points. Okay, so these are all the things that you get. Okay, I have already discussed. Then also, if you have any questions regarding anything of the forensic medicine, you can just write in the comments, and I will definitely give answers either through, if it is a big, then I will give through a video, or just give in the comment section. Okay, so this was everything about the forensic medicine, from syllabus to how do you prepare for written as well as viva examination. Okay, alright then. Thank you everyone. Assalamu alaikum.